Marijuana a horrible drug that leads users to try harder drugs, or is it a powerful medicine that can help the sick relieve the worst symptoms of their disease? Those are the questions being asked across the country as several states grapple with the idea of making marijuana legal for medical use. Here in Texas, patients are fighting for safe, legal access to that drug, a drug that has been demonized for decades. The 9 Team's Tim Gerber shows us how pot is helping some patients.
Tim Timmons isn't getting high. He's taking his medicine.
I would not be your average pot smoker.
The former athlete has multiple sclerosis.
I would be considered in one of the final stages of the disease right now.
His doctors prescribed powerful narcotics to treat his painful condition. 5 years ago, he discovered pot did a better job.
The pain relief was immediate. And I thought, whoa, what's the problem with this if it works this well for people that are in pain?
Timmons has become the face of the movement to get medical marijuana legalized in Texas, a step 13 other states have already taken.
And you think, well, how is it that it can be helping these people in these states, but it won't help me in Texas?
Convincing socially conservative Texans to pass medical marijuana legislation has proved to be a tough sell. Every bill that's been introduced here has died in committee, but that hasn't killed the movement.
Caring for people and allowing people to care for their loved ones is not something that should be criminalized.
Stephen Betzen's wife smokes marijuana to relieve pain caused by Lyme disease. He's trying to convince lawmakers to allow patients safe access to their medicine.
This has changed our lives in tangible ways that are positive and cannot be denied.
While many patients hide in the shadows, Timmons isn't afraid of being arrested.
If I can break the law as many times as I possibly can to help someone else, then heck, man, I'm all for breaking the law.
Because of the potential harmful effects of smoking, most doctors are pretty reluctant to advise patients to try pot. Instead, many prescribe a pill called Marinol. It's a synthetic version of THC, which is the chemical of marijuana that gets you high and relieves many of the symptoms. But many patients say that pill takes hours to relieve their symptoms, whereas one toke of pot works in seconds. As the debate rages on, many doctors and medical organizations are now encouraging further study of the medicinal properties of marijuana.